Hello and welcome back. During this particular video, the second portion of the development video, we're going to talk about the fetal period. The fetal period begins at about the ninth week of after fertilization. The tissues and organs that develop during the embryonic period grow and differentiate. Very few new structures appear during this period, and this is just a sequence of pictures showing you what the embryo all the way to the fetus looks like. So here we have the 20-day embryo, the 24-day embryo, 30-day embryo begins to kind of look like a human a little bit, 44-day embryo, 50-day embryo. Then we begin to look at the fetus. So this is the fetus, and then around 13 weeks, this is what the fetus looks like. So really kind of looks like a baby that's going to be born. But there are some refinements that have to happen, growth and differentiation of the organs up to the 26-day fetus. And so you can see just kind of the changes in size between the 4-day embryo and then the 4-week embryo and then the 36-week fetus. So kind of dimensional sizes that are changing. Okay, so that's what occurs in the fetus. Of course, the fetus is much more intricate and important than that, but for time's sake, that's what I have to talk to you about. So hormonal induction of labor. So estrogen made by the placenta will induce the uterus to produce oxytocin receptors, specifically in the smooth muscle tissue of the uterus. Fetal cells, as they mature, they'll begin to produce oxytocin and release it into mom's circulation. This causes the placenta to produce prostaglandins. Both the hormones, oxytocin and prostaglandins, will cause contraction of the uterus. So many of those early contractions are caused because the baby's producing oxytocin and the placenta is producing prostaglandins because of the oxytocin that's being produced. Once contractions begin, like at the very end of pregnancy, female emotions will activate the hypothalamus to release oxytocin into the posterior pituitary. That goes into circulation and will go down to the smooth muscle tissue of the uterus. So this oxytocin will cause strong uterine contractions, and then a positive feedback loop will develop when you have really strong uterine contractions. That causes a signal to go up to the hypothalamus to cause more release of oxytocin, which causes more extreme contractions. So that positive feedback loop eventually ends after the birth of the child. So labor does have a series of stages it goes through. The first stage is called the dilation stage. So as the infant's head is forced against the cervix will basically dilate or enlarge so that the baby can fit through it. At this point in time, perhaps the amniotic sac also ruptures. That fluid will help the baby slide through the birth canal a little bit more efficiently. The expulsion stage is where the infant's delivered, and then we have the placental stage where the placenta removes itself from the wall of the uterus and is also delivered. We then have the contraction of the uterus down to a smaller size so that all those blood vessels that are left basically bleeding are going to cauterize themselves from the shrinking uterus. So this just goes through a series of stages. We have the amniotic fluid up here. The umbilical cord is still nourishing the baby. Placenta is still attached to the wall of the uterus, and the cervix is there ready to dilate. Notice that the baby at the end of pregnancy will turn head down so that it fits through the birth canal first. The head needs to go through first because feet first, sometimes arms will get stuck in the as it's coming out of the birth canal. So this is just showing you a little sequence here. The baby's head down. It then turns towards the vertebral column. So you want the head to come out this way. It just makes it easier for it to come out. You can see now it's basically coming out. Then we have the placenta removing itself from the wall of the uterus. That will come out. So following delivery, it takes about 6 weeks for the maternal reproductive organs and the physiology to return to pre-pregnancy state. This period, is pretty important. It's sometimes women will go through postpartum depression due to the reduction in the estrogens and progesterones that the placenta was making. So what also happens after delivery is you have the reduction in the size of the uterus. So breastfeeding, oddly enough, produces oxytocin, which causes the uterus to contract. So breastfeeding, not only is it good for the baby, it's good for the mother to reduce the size of the uterus and to help to prevent bleeding after birth. Now I want to talk to you just for a second about teratogens. Teratogens are any agent or influence that's able to cause developmental defects in an embryo or fetus. So this is a teratogen. Any number of chemicals and drugs may be considered teratogens. Alcohol is the most common teratogen that fetuses are probably exposed to, and it causes fetal alcohol syndrome. This is a severe neurological defect in babies due to alcohol consumption by the mother. There are other things that are teratogens: viruses, industrial chemicals, hormones, antibiotics, cocaine. So Accutane, used for acne, is a teratogen as well. Cigarette smoking during pregnancy has also been implicated as a cause of low infant birth weight, cardiac anomalies, and basically higher fetal mortality. So ionizing radiation in many forms is also teratogenic. Exposure of the mother to X-rays or radioactive isotopes during pregnancy may cause microcephaly, which is a small head, and mental retardation and skeletal deformities. So if you ever find yourself pregnant, make sure you don't ingest alcohol, cigarette smoke, or any other teratogen, so you can give your baby, as good a start as it possibly can have. There are prenatal diagnostic tests that sometimes are given to see what's going on in the fetus. So during pregnancy, these medical tests are used to detect fetal abnormalities, genetic disorders, and just the well-being of the fetus. So we have all kinds of ultrasounds that can be done to give accurate fetal age and the date of conception, when the date of conception is in doubt. It also is used to confirm pregnancy, these fetal ultrasounds, and to determine fetal position, and also identify multiple pregnancies, and also, are the organs developing correctly? That can be determined by ultrasonography. So amniocentesis is something that's done in more of a high-risk pregnancy, and it's involved in removing amniotic fluid surrounding the developing fetus and then analyzing it and the fetal cells for genetic anomalies. It's usually performed between the weeks of 14 and 18. The needle used to collect the fluid is guided by an ultrasound so that the doctor will avoid puncturing anything that's not that you shouldn't puncture. So here you can see the needle, and you can see the ultrasound transducer. Basically, it helps to guide the doctor into the amniotic cavity. So that's important that they don't stab something that shouldn't be punctured. Chorionic villus sampling may also be performed as early as 8 weeks of gestation, and it's also done under the ultrasound guidance. This procedure typically uses a catheter that's inserted through the vagina and then through the cervix to collect the tissue from the chorionic villi. The goal of these tests is to identify genetic defects, just like amniocentesis was doing. The procedure may be done through the abdominal wall, as with amniocentesis. So here you can see the needles being inserted. Although we're not going to the amniotic sac this time, we're using the ultrasound transducer to either sample the chorionic villi through a needle or through a catheter that we stick through the vaginal canal and through the cervix, and then sample a little bit of that tissue up there. Remember, if you sample chorionic villi, that's fetal tissue, and the genetics of that will be identical to the baby. So that's a good way of testing for genetic anomalies. There are some non-invasive prenatal tests that can be performed, but they're not as informative as amniocentesis or chorionic villus sampling. So maternal alpha fetal protein tests, or AFP tests, require a blood sample from the mother. It's used to detect AFP, which is a protein produced by the fetus between the weeks of 12 and 15. And then after the 16th week of pregnancy, the levels of AFP go to 0. High levels after this point in time, after 16 weeks, indicates there may be some kind of neural tube defect or deformation. So after the baby's first breath, many changes must be made in its cardiovascular system over time. Fetal circulation is a little different than infant circulation because the fetus is not breathing air through its lungs, it's deriving oxygen through the umbilical cord. So there is a foramen ovale. This basically connects the right atrium and the left atrium. It's a hole in the heart, and that at birth will seal, creating the fossa ovalis. The ductus arteriosus, which is another connecting, let me go ahead and show you the little picture here. So the ductus arteriosus, let me see if I can get my picture here. Let me get my pen. So the ductus arteriosus is a connecting tube between the pulmonary trunk and the aorta. Okay, so that in fetal life helps the blood that's coming from the mother to go directly into the aorta. There's no reason for it to really go to the lungs. So that is going to become the ligamentum arteriosum, as you can see over here. And it's just a ligament that connects the pulmonary trunk to the aorta. So the umbilical arteries will fill with connective tissue. The umbilical veins will become the ligamentum teres of the liver. So here we can see the foramen ovale. That's the connecting between the right atrium and the left atrium. That becomes the fossa ovalis. The ductus arteriosus, which was the connection of the fetal circulation, the pulmonary trunk to the aorta, becomes a little ligament supporting ligament. So the ductus venosus, which brought blood from the umbilical cord to the inferior vena cava, becomes a ligament, and the umbilical vein also becomes a ligament in the mature child. So the umbilical arteries also become ligaments as well. So each structure becomes something in the infant, but the circulation pattern has to change because the infant begins to use its lungs. Okay, well, this has been a long haul, and so I appreciate your attention, and I hope that you will continue to study and do everything you need to do to be a great anatomy student. Okay, so I'm signing off, and I will see you at a later time, probably.